Well, moving on now, the Democratic Nursing Organization of South Africa in Mpumalanga is holding its provincial congress to, among other things, elect new leadership and reflect on progress made and challenges facing the organization. The congress is held at a time when the health sector in the province is facing numerous challenges, which include shortage of staff at health facilities and lack of medical equipment. Our reporter Mweli Masilela is there covering the story for us. Mweli, what is the latest from the conference?
Good morning to you and the viewers. Yes, we are coming to you live from Bombela. This is where the 8th DENOSA Provincial Congress is being held. As you have highlighted on your introduction, yes, there will be, among other things, electing new leadership that will be taking over from the outgoing leadership. And also, you'll know that the issue of the health sector in the province has been on discussion for quite a long time now, and we are expecting that the leadership of DENOSA and other alliance partners that will be delivering messages of support will be touching on these issues. But now I'm joined by the Provincial Secretary Mzwandile Shongwe to tell us more about what we can expect here. If you can tell us what is it that we can expect from today's Provincial Congress?
Good morning, Moele and the viewers. Here today we're having our conference. Firstly, we're to discuss issues that are affecting the health sector as nurses in this province. We've got key issues here. The first issue that we're going to discuss here is the issue of non-nursing duties, because we've got a lot of nurses that are doing work that is not nursing-based. Some are drivers, driving mobile clinics and so on. So we want to put a stop on all that so that nurses can focus in their work. And that is, of course, going to improve the quality of care that we give to our people. The other thing that we're going to discuss is the issue of safety in facilities, because as nurses in facilities were being assaulted by our communities, including our own patients are being assaulted in facilities. So we are not safe in health facilities. In fact, that's what we are saying. And we think that government must bring a stop in this thing of outsourcing security and must insource security so that at least we are able to have safety within and control it within the health sector. So we're here.
Well, we seem to have lost that link to Mweli. We'll try and catch up with him if we can.
Employ more staff so that at least we're able to deliver quality care to our people. And in so saying, we're also saying the department must also deal with the issue of employing more porters, more cleaners, so that nurses, data capturers and so on, so that nurses are able to leave these non-nursing duties and relevant people are able to do their work. This is the elective conference. We're, of course, going to elect the leadership here, the chairperson, the deputy chairperson of the province and the treasurer. We're going to elect it in this conference. Thank you.
We understand that there will also be alliance partners delivering messages of support. Who can we expect in terms of representation of those alliance partners?
From the African National Congress, we know that the acting secretary, Comrade Challenger, is coming, will be here. We're expecting the provincial secretary of the SABC, Comrade Bonagele Machuba, to address this Congress. We're expecting the provincial secretary of COSAT, Comrade David Mkwena, to address this Congress. We're expecting Comrade Mike Sow, as a secretary of Sanko, to come and address this. So all the progressive forces will be here addressing this conference today.
Any representative from the national leadership of DENOSA will be?
Yes, we have the president of DENOSA, Comrade Simon Hlungwane, will be giving the keynote address to this Congress today. So he's coming. He's going to be here also.
Well, as you've heard, that is the Provincial Secretary of DENOSA, Mzwandile Shongwe, giving us an update on what we can expect from this provincial conference that is going on. We'll keep you updated as the day progresses. It's back to you in studio.
Okay, Mweli, tell us more about some of the challenges faced by the health department in that province.
Well, as you have heard from the Provincial Secretary, there's quite a number of challenges that he has highlighted, mainly the issue of the shortage of staff in health facilities across the province. Well, that is a story that we have been telling for a long time as SABC News. He also highlighted on another issue of the lack of medical equipment in hospitals. But he is still here. I want to ask him in terms of how is the health department responding when they raise those issues? As you are saying that we're expecting the MEC of the Department of Health to be here today. You've been raising these issues. How are they responding when you raise these concerns?
I must say it, Kodumwel, that they've been responding well. The only thing is that is the issue of finance. They are saying they don't have enough money to employ more and so on. So we're engaging further, even engaging the Office of the Premier to ensure that using the COSATU cap to ensure that at least we're able to deal with these issues that we're having in the department. So working together with them, there is a way forward on the issues.
The state of health facilities, I know that over the years there's been some construction of new hospitals and clinics across the province, but are you satisfied when it comes to the health facilities in the province?
I must say, that we are not happy. We are not happy because we've got a lot of dilapidated facilities in Mpumalanga. And we've been saying that the department must improve. And worse is that Mpumalanga is a pilot site for NHI. So one would expect that the facilities must have equipment, good facilities, so that nurses are able to work in those facilities. But we've got areas where we have challenges in terms of that. But I must indicate that we've noticed a little bit of building infrastructure in Hertzband because it's a pilot site, but the pace is very low. The pace is very low. They must speed up the process so that at least our people are able to receive care.
I know that already there's people who are saying who are saying that the health sector in the province has actually collapsed. There are also those who are saying it's on the brink of collapse. What is your analysis when looking into the health sector in the province?
I wouldn't say it has collapsed per se, but of course recognize that there are challenges that the health sector is having. And those challenges must be dealt with and be given attention so that at least they are dealt with and be closed. But I wouldn't say it has reached a stage where we would say it is collapsed. But it must be able to respond to the challenges that we are having, which the pace in terms of the response is very slow. And we are not happy with that.
As we'll be discussing, what is it that must be done? You've touched on the issue of shortage of staff in hospitals, the issue of lack of medical equipment. What is it that must be done to address those issues?
Firstly, we expect that the department must employ more human resource because they have reduced the capacity of the department in terms of human resource. Before we're talking, in fact 5 years back we're talking about a capacity of 34,000, but now it has reduced to less than 20,000. And that tells you that in facilities we're running short. We're running at 40% in some of the facilities. Wheatbank Hospital is one of those that are running at 40% capacity in terms of the staff. So that says that they must employ more staff. We're expecting that they must in-source security. People are chowing money and they're not providing service. And we're not happy about that because our people are being attacked, our patients are being attacked in facilities. We want them to employ a security so that we can have direct control. People must know this thing of entrepreneurs is not assisting us at all. They must employ so that at least we are able to have security and our people will be safe in facilities. The issue of non-nursing duties, we are raising it and we're not going to be apologetic about it. We will reach a point where we're going to say nurses must stop doing non-nursing duties. So that says to you that a mobile clinic may not travel to see patients somewhere if there is no drive. So we expect that the department must employ the human resource necessary because nurses are busy capturing data in facilities while the department must employ data capturers. And we're not happy about that. We're saying the department must employ more human resource so that it can be able to deliver capacity service, quality service to our people.
Well, that is Mzondile Shong talking about the ongoing Provincial Congress of DENOSA. He's saying that they will be engaging on a number of issues here, and they're hoping that by the end of this provincial conference, which is a 2-day conference, they will come up with resolutions that will help improve the health sector in the province. But for now, it's back to you in studio.
Thank you very much indeed. That was our reporter Mweli Masilela reporting to us live from Mpumalanga, the DENOSA Congress that's taking place. We're going to take a short break.